Ever wondered about the difference between acute kidney injury and chronic kidney disease? Well, you're in the right place. Kidney diseases are complex and can be broadly categorized into two main types: acute kidney injury, commonly known as AKI, and chronic kidney disease, or CKD for short. AKI is a sudden, rapid decline in kidney function. It's like a sudden storm, wreaking havoc over a short period and then, with proper care, often receding. On the other hand, CKD is a long-term condition, a gradual erosion of kidney function over an extended period, like a slow, relentless tide. Both AKI and CKD affect the kidney's ability to filter waste and excess fluids from the body, but they do so in different ways and have distinct characteristics. Understanding these differences is crucial, as both can have serious consequences. Stay tuned as we delve deeper into these two conditions and explore their differences. Acute kidney injury, also known as AKI, is a rapid decline in kidney function. Imagine a perfectly working machine that suddenly goes haywire. That's what AKI is like for your kidneys. It's characterized by a sudden loss of the kidney's ability to filter waste and eliminate excess fluids from the body, which can happen over mere hours or days. A variety of factors can cause AKI, including severe infections, dehydration, reduced blood flow to the kidneys due to shock or heart failure, certain medications, toxins, and traumatic injuries. It's like a surprise attack on your kidneys coming from all directions. The symptoms are just as varied and can be quite elusive. They may include decreased urine output, fluid retention leading to swelling in your legs, ankles, or feet, fatigue, confusion, and even electrolyte imbalances that can cause heart problems. Diagnosing AKI is a bit like piecing together a puzzle. Doctors use laboratory tests such as blood and urine tests to get the full picture. The treatment then is about addressing the underlying cause, providing supportive measures like medications to maintain the right balance of fluids and electrolytes in the body, and sometimes even dialysis to assist kidney function until recovery. AKI may sound like a daunting adversary, but with prompt diagnosis and appropriate treatment, the kidneys can often recover. It's a battle, but it's one that can be won. Now that we understand AKI, let's turn our attention to chronic kidney disease. Chronic kidney disease, or CKD, is a gradual loss of kidney function over time. Unlike acute kidney injury, which happens suddenly, CKD is a long-term condition that develops quietly over months or even years. Now, what causes this stealthy disease? The most common culprits are diabetes and high blood pressure, but other conditions like glomerulonephritis and polycystic kidney disease can also be to blame. The tricky part about CKD is that the early stages often come without any symptoms. It's like a silent intruder making its way in unnoticed. But as it progresses, signs like fatigue, swelling, and changes in urine output can start to show up. More severe complications like anemia and bone disease may also occur. To understand the severity of CKD, it's categorized into 5 stages. Stage 1 is the mildest, with minimal damage to the kidneys. But by the time we reach stage 5, we're looking at significant kidney damage, which may require advanced medical intervention, such as dialysis or even a kidney transplant. Diagnosis of CKD involves a series of tests, including blood and urine tests, imaging studies, and blood pressure monitoring. Managing CKD focuses on controlling the underlying conditions and making lifestyle modifications. In the later stages, dialysis or transplantation might be necessary. As we can see, AKI and CKD, while both affecting the kidneys, have distinct characteristics. To summarize, both AKI and CKD affect the kidneys but in different ways. Acute kidney injury, or AKI, is a sudden and rapid decline in kidney function, often due to severe infections, dehydration, or reduced blood flow to the kidneys. Its symptoms can include decreased urine output, fluid retention, and fatigue, among others, and it's diagnosed through laboratory tests. On the other hand, chronic kidney disease, or CKD, is a gradual loss of kidney function over an extended period. It's often caused by conditions like diabetes or hypertension and can progress through 5 stages. Symptoms may be absent in early stages, but as the disease progresses, you might experience fatigue, swelling, and changes in urine output. Both these conditions require prompt diagnosis and management for a better prognosis. Preventive measures such as maintaining a healthy lifestyle and managing chronic conditions can reduce the risk. Remember, early detection and treatment are key to managing these conditions, so don't ignore the signs. Consult with a healthcare professional if you have concerns about your kidney health.